These are some general tips on how to bring up psychogastroenterology to patients. Laurie Keefer, in particular, talks about ways for gastroenterologists to bring up GI Psych to patients on an episode of the podcast Talking Gut with Dr. Jim Kantidakis. The link is in the description if you want to listen to the whole thing. Here are some of the highlights. The sooner you bring up behavioral therapies, the less awkward it will be when you bring it up later versus waiting until you're exasperated with the patient's symptoms or things aren't working. And one way to say it in the beginning is that there's 3 or 4 ways to approach this problem. There's medication that affects how the brain and the gut communicate. There's dietary or supplement adjustments. And there's also behavioral interventions through working with the GI Psych. And the GastroPsych can help you understand your gut better to improve your symptoms and symptom management. And all of these ways actually affect the gut-brain axis. They just come in at different avenues. The prescription is a gut-brain therapy, and we get to figure out which ones to try. It's a gut-brain problem, and we need a gut-brain solution. So again, if you want to listen to that podcast episode, the link is in the description below. And overall, here's 4 other helpful things that might be useful to bring up when talking about GI Psych to patients. One thing is that GI Psych is the practice of paying attention to how we think, how we feel, and how we respond to our gut, and vice versa. How our gut affects how we feel and function physically, emotionally, socially, and mentally. GastroPsych includes symptom specific work as well as general practices that affect gut symptoms and functioning. The provider may also recommend some other services as well. The second thing is that GastroPsych is an appropriate intervention if the person's GI problems are in the front seat of priorities or problems for them. If it's more something that's in the back seat of the things that they're dealing with, then GastroPsych may not be the best intervention. The third thing is that when meeting with a GI psych, the patient should expect to look specifically at behavioral changes that may be appropriate to try. So sometimes people may be apprehensive about psych in general because they're like, I don't want to talk about my childhood. That's totally fine. That's not part of GI psych. Sometimes those things come up because of behavioral things that we're talking about presently, but that is not the focus of treatment. The fourth thing is that sometimes a gastropsych may focus on strategies that really hone in on the interplay between symptoms, thoughts, and emotional responses. And usually, this kind of work is done in a cognitive behavioral therapy or CBT style of work. There are also interventions like gut directed hypnotherapy, which is a different video and it's in the description below. Ideally, the GI Psych provider can also help identify other psychological aspects that may be helpful to attend to, and then connect the patient or the person to an appropriate provider for the related or ongoing work. If you don't have a GI Psych on your team, there are databases where patients can find a provider, and I've included a link in the description below. Sometimes they can be referred to general psych, especially if a provider has had some experience in effectively working with patients with that GI condition. There are also some other resources that exist for people to explore on their own in the absence of an available provider, and the link for that is in the description. Between all of these different pieces, I hope that there was something useful in here that may help you more easily bring up GI Psych to your patients.